Cardiovascular Pharmacology review questions. For our first question, what effects does halothane have on the cardiovascular system? A. Depresses myocardial contractility but maintains normal blood pressure by stimulating the sympathetic nervous system. B. Maintains normal blood pressure by stimulating the baroreceptor reflex. C. Protects the heart from the arrhythmogenic effects of epinephrine. And D. Can induce spontaneous arrhythmias, especially at light surgical anesthesia, stage 3, plain 1. The answer for that would be D. Animals subjected to light planes of halothane anesthesia are more prone to spontaneous arrhythmias. For question number 2, what is a cardiovascular side effect of most barbiturates? A. Bradycardia in dogs caused by stimulation of the vagus nerve. B. Tachycardia in dogs secondary to peripheral vasodilation and decreased arterial pressure. C. Prevention of catecholamine-induced arrhythmias. Or D. Increased mean arterial pressure. The answer for that would be B. Tachycardia is a common finding of barbiturate anesthesia. Barbiturates potentiate catecholamine-induced arrhythmias, which means arterial pressure and cardiac output decrease. For question number 3, cardiac glycosides exert their cellular effects on the heart by A. Blocking fast sodium channels, B. Inactivating troponin and tropomyosin, C. Inhibiting membrane voltage-dependent calcium channels, and D. Inhibiting membrane sodium-potassium ATPase. The answer for question number 3 is D. Cardiac glycosides bind to and inhibit the sodium-potassium ATPase pump. For question number 4, we have at therapeutic levels, cardiac glycosides produce all of the following effects except A. Increased cardiac output at all levels of ventricular and diastolic volume, B. Reflex withdrawal of sympathetic vasomotor loan or vasodilation, C. Increased myocardial oxygen consumption, and D. Slowed heart rate. The answer for that question is letter C. Cardiac glycosides increase cardiac output, withdraw sympathetic tone, slow the heart rate, and reduce myocardial oxygen consumption. For our next question, question number 5, how does digitalis therapy increase urine output in patients with heart failure? A. Direct blockade of sodium resorption in the proximal tubule. B. Competition for antidiuretic hormone receptors in the collecting duct. C. Stimulation of central thirst centers with secondary polydipsia. And D. Secondary to increased renal perfusion because of improved hemodynamics. The answer for that question is letter D. Cardiac glycosides increase urine output in patients with heart failure by improving renal perfusion, secondary to improved hemodynamics. Diuresis is not caused by a direct effect on the kidney. For our question number 6, digitalis therapy is beneficial in treating atrial fibrillation because it A. decreases the refractory period in atrial muscle, B. slows atrioventricular conduction, C. converts the rhythm to normal sinus rhythm, and D. increases atrial muscle contractility. The answer for that question is letter B. Cardiac glycosides do not convert atrial fibrillation to normal sinus rhythm, rather they slow the ventricular rate by decreasing atrioventricular conduction. For our question number 7, in which situation is digitalis contraindicated? A. Congestive heart failure, B. First or second degree atrioventricular block, C. Atrial fibrillation and atrial flutter, D. Supraventricular tachycardia. The answer for question number 7 is letter B. First or second degree atrioventricular block because cardiac glycosides decrease atrioventricular conduction. They are contraindicated in first or second degree atrioventricular block. Question number 8. Which drug dilates blood vessel by competitive antagonism of alpha-1 adrenergic receptors? A. Nitroglycerin, B. nitroprusside sodium, C. prazosin, and D. diltiazem. The answer for the number 8 question would be C. Prazosin is a preferential alpha-1 adrenergic receptor antagonist. For question number 9, blood volume is reduced after therapy with angiotensin converting enzyme inhibitors because of A. Increased aldosterone secretion, B. Decreased aldosterone and antidiuretic hormone secretion, C. Increased aldosterone and antidiuretic hormone secretion, and D. Decreased antidiuretic hormone secretion. The answer is letter B. Blood volume decreases after therapy with AC inhibitors because of natriuresis secondary to decreased aldosterone secretion. Natriuresis is followed by decreased ADH secretion and decreased renal water resorption. For question number 10, we have angiotensin converting enzyme inhibitors may cause renal failure in dogs with congestive heart failure through afferent glomerular arteriolar constriction, B. Afferent glomerular arteriolar dilation, C. Afferent glomerular arteriolar constriction, and D. Afferent glomerular arteriolar dilation. The answer for number 10 question is letter D. Angiotensin 2 causes constriction of afferent glomerular arterioles. ACE inhibitors prevent this constriction by decreasing angiotensin 2 levels, thereby reducing the glomerular filtration rate. For question number 11, we have which of the following does not increase the risk of renal failure associated with angiotensin converting enzyme inhibitor therapy? A. Hypovolemia, B. Vomiting, C. Hypotension, and D. Oxygen therapy. The answer for that question is letter D. Answers A through D tend to lower blood volume and result in prerenal azotemia. Volume contraction predisposes animals to ACE inhibitor-induced renal failure. Question number 12 concerning enalapril, which statement is most accurate? A. Enalapril is the active form of the drug. B. It is associated with a significant first pass effect. C. It has a more rapid onset of action than captopril. D. It has a longer duration of action than captopril. The answer for that question is letter D, because enalapril has a slower onset of action but a longer duration of action than captopril. Once daily dosing is possible. Question number 13 concerning the action of verapamil on the heart, which statement is least accurate? A. It is a negative inotrope. B. It is a negative chromotrope. C. It speeds conduction through the atrioventricular node. And D. It decreases the rate of sinoatrial discharge. The answer for that question is letter C. It speeds conduction through the atrioventricular node because calcium channel blockers slow conduction through the atrioventricular node and are therefore indicated in treatment of supraventricular tachycardia. For question number 14, we have what is the predominant mechanism of action of class 1 antiarrhythmics? A. F3 adrenergic receptor blockade, B. calcium channel blockade, C. potassium channel blockade, and letter D. sodium channel blockade. The answer for question number 14 is letter D. The predominant mechanism of action of all class 1 antiarrhythmics is blocking of sodium channels. Next question, we have question number 15. What is the predominant mechanism of action of class 3 antiarrhythmics? A. L3 adrenergic receptor blockade, B. calcium channel blockade, C. potassium channel blockade, and D. sodium channel blockade. The answer for that question is letter C. The predominant mechanism of action of all class 3 antiarrhythmics is blocking of potassium channels. Question number 16. What is the major electrophysiologic effect of quinidine on atrial and ventricular muscle that accounts for its antiarrhythmic properties? A. Decreased phase 0 depolarization, B. Decreased phase 1 depolarization, C. Decreased phase 2 depolarization, and D. Decreased phase 3 repolarization. The answer for that question is letter A. Quinine is a class 1A antiarrhythmic that blocks sodium channels. This blockade decreases the rate of phase 0 depolarization in atrial and ventricular muscle. For question number 17, we have a drug used to treat atrial fibrillation is A. aminophylline, B. lidocaine, C. nitroglycerin, and D. procainamide. The answer for question number 17 is letter D. Procainamide is the only drug listed that is effective for treatment of supraventricular arrhythmias. Next, we have question number 18. Dose-related cardiac damage is an important toxic effect of the chemotherapeutic agent A. mithramycin, B. doxorubicin, C. 5-fluorouracil, and D. chlorambucil. The answer for that question is letter B. Anthracycline antibiotics such as doxorubicin cause cumulative dose-related cardiomyopathy. Moving forward, we have question number 19. A purely venous vasodilator would be most useful in treating which of the following conditions? A. Chronic stable dilated cardiomyopathy, B. Aortic regurgitation from endocarditis, C. Cardiac tamponade with ascites, D. Mitral regurgitation with acute pulmonary edema. The answer for question number 19 is letter D. Cases of acute fulminant cardiogenic pulmonary edema are most likely to benefit from preload reduction with a venodilator. Preload reduction would be harmful in cardiac tamponade. Question number 20. A middle-aged cat is diagnosed with HCM. Which of the following drugs would be most effective for treating the diastolic dysfunction caused by this disease? A. furosemide, B. diltiazem, C. digoxin, D. hydralazine or hydralazine. The answer for that question is letter B. Treatment of diastolic dysfunction centers on slowing heart rate, decreasing myocardial oxygen consumption, and enhancing relaxation. Question number 21. All of the following angiotensin converting enzyme inhibitors are excreted mainly by the kidney except A. captopril, B. enalapril, C. lisinopril, D. benazepril. The answer for that question is letter D. Benazepril has approximately equal biliary and renal excretion. For question number 22, we have which of the following statements regarding hydralazine or hydralazine is true? Hydralazine acts to dilate both arterioles and veins. Hydralazine directly dilates arteriolar smooth muscle. Vasodilation is more pronounced in skeletal muscle and skin with hydralazine. And letter D, hypotension and reflex tachycardia are uncommon side effects. The answer for question number 22 is letter B. Hydralazine is a direct arteriolar dilator. Vasodilation is more pronounced in cerebral, coronary, and splanchnic circulations. Hypotension and reflex tachycardia are common side effects. Enhancement of the neurohormonal response is thought to occur. For question number 23, in general, digoxin would be indicated for a dog with A. dilated cardiomyopathy and atrial fibrillation, B. heartworm disease, C. pericardial effusion, and D. hypertrophic cardiomyopathy. The answer for that question is letter A. Digoxin is most often used in the treatment of myocardial failure, especially when atrial fibrillation exists. Other diseases listed do not have systolic dysfunction. Question number 24, we have a dog is being given oral digoxin for heart failure. Which of the following would yield the best absorption? A. Use of a tablet form, B. Use of the elixir form, C. Giving the drug with food, and D. Concurrent kaolin-pectin use. The answer for question number 24 is letter B. Absorption is better with the elixir than with the tablet form. The other factors listed decrease absorption. For question number 25, we have the mechanism of action of digoxin's positive inotropic effect is A. Direct stimulation of a sodium-calcium exchanger, B. Competitive inhibition of sodium-potassium ATPase, and C. Activation of GS protein, and D. Peripheral and central sympathetic stimulation. The answer for number 25's question is letter B. Digoxin inhibits sodium-potassium ATPase at the myocardial cell membrane, which allows sodium to build up inside the cell. This enhances its exchange with extracellular calcium. The resulting increase in intracellular calcium leads to a positive inotropic effect. Question number 26 we have regarding pimobendan. All the following are true except elimination in the dog is primarily via hepatic metabolism. B. There is an active metabolite. C. The drug is often called an inodilator. And D. The drug substantially increases myocardial oxygen requirement while increasing contractility. Answer for that question is letter D. The drug sensitizes the contractile filaments to calcium ion, so can increase contractility with minimal impact on myocardial oxygen requirement. Question number 27, we have all the following predisposed to digoxin toxicity except use of loading doses, hypokalemia, renal disease, and letter D, cholestyramine. The answer for question number 27 is letter D. Cholestyramine will bind digoxin in the gut and may be helpful immediately after oral overdose. All the other conditions predispose to toxicity. For question number 28, we have a dog is presented in severe heart failure from dilated cardiomyopathy. You decide to institute therapy with a catecholamine. Regarding dopamine and dobutamine, all the following are true except both agents have a T1/2 between 10 and 20 minutes. B. Both agents have extensive hepatic metabolism. C. Long-term use is limited by beta receptor downregulation. And D. Dopamine but not dobutamine stimulates vasodilatory dopaminergic receptors. The answer for that question is letter A. The T1/2 of these agents is less than 2 minutes. That, as well as their rapid hepatic metabolism, means they are effectively given only by IV infusion. Moving forward, we have question number 29. In the same dog as above, we also consider amrinone therapy. All of the following are true regarding amrinone except A. It acts by inhibiting phosphodiesterase. B. Peak effects occur after 45 minutes of infusion in dogs. C. It can be used orally twice a day. And D. Vasodilation is also an effect. So for the question number 29, the answer is letter C, because amrinone's short T1/2 necessitates IV administration, usually by constant infusion. Question number 30, we have drugs which act by blocking beta-adrenergic receptors comprise which class of antiarrhythmic agents? A. Class 1, B. Class 2, C. Class 3, D. Class 4. The answer for that question would be letter B. Beta blockers are considered class 2 agents according to Vaughan Williams classification system. Moving on, we have question number 31. Which antiarrhythmic drug is incorrectly matched with its classification? A. Lidocaine class 1A, B. Procainamide class 1A, C. Tocainide class 1B, and D. Quinidine class 1A. The answer for that question would be letter A. Lidocaine class 1A, because lidocaine is a class 1B drug like tocainide. For question number 32, we have when used IV, lidocaine has all of the following effects except A. It usually suppresses premature ventricular contractions. B. It consistently abolishes atrial arrhythmias. C. It decreases sodium conductance in automatic cells. And D. It has little to no effect on sinus node pacemaker function. The answer for that question is letter B. It consistently abolishes atrial arrhythmias, because lidocaine is generally effective for ventricular but not usually for supraventricular or atrial tachyarrhythmias. Next question, we have question number 33. The drug generally used for converting atrial fibrillation in horses without heart failure is A. Prekinamide, B. Quinidine, C. Propranolol or propanolol, and D. Diltiazem. The answer for question number 33 is B. Quinidine is often successful in converting atrial fibrillation in horses without heart failure or significant underlying cardiac disease. Next, we have question number 34 regarding the adverse effects of class 1 antiarrhythmic drugs. Which statement is incorrect? A. Central nervous system excitement is the most common toxic effect of lidocaine. B. Cats and horses are very sensitive to the toxic effects of lidocaine. C. Exacerbation of arrhythmias is not a problem with class 1A drugs. And D. GI upset can occur with quinidine and prekinamide. The answer for that question is letter C. Exacerbation of arrhythmias is not a problem with class 1A drugs because all antiarrhythmic drugs can have pro-arrhythmic effects. For our question number 35, a 9-year-old beagle has an irregular heartbeat and lethargy. Radiographs show moderate cardiomegaly. ECG shows second-degree heart block. Based on the information given, appropriate therapy would include A. Digoxin, B. Propanolol, C. Prekinamide, and D. Propanthyline bromide. The answer for that question is letter D. Propanthyline bromide because anticholinergic therapy is initially indicated for symptomatic second-degree heart block. The other agents listed are relatively or absolutely contraindicated with AV nodal disease. For question number 36, we have heparin is used in cats after acute thromboembolism because of its inhibitory effects on coagulation. In combination with antithrombin 3, it neutralizes all the following factors except A. 12, B. 11, C. 10, or D. 8. The answer for question number 36 is letter D. 8. The heparin antithrombin 3 complex neutralizes factors 12, 11, 10, 9, and 2. For our next question, question number 37. These drugs may help control blood pressure by reducing angiotensin 2 formation, vasodilator kinin degradation, and or aldosterone secretion. A. Angiotensin converting enzyme inhibitors, B. Beta blockers, C. Diuretics, D. Digoxin. The answer for that question is letter A. ACEI may help control BP by reducing angiotensin 2 formation, vasodilator kinin degradation, and or aldosterone secretion. Next question, we have these drugs may reduce blood pressure by slowing heart rate and decreasing cardiac output and renal renin release. A. Angiotensin converting enzyme inhibitors, B. Beta blockers, C. Diuretics, D. Digoxin.
And the answer for question number 38 is letter B. Beta blockers may reduce blood pressure by slowing heart rate and decreasing cardiac output and renal renin release. A beta blocker is recommended for cats with hyperthyroid-induced hypertension, but beta blockers are often ineffective as the sole antihypertensive agent in cats with renal disease.
For question number 39, we have these drugs may reduce blood pressure by promoting sodium and water excretion. Furosemide is usually tried, although hydrochlorothiazide may be helpful in non-azotemic dogs. A. Angiotensin converting enzyme inhibitors, B. Beta blockers, C. Diuretics, D. Digoxin. The answer for question number 35 is letter C. Diuretics may reduce blood pressure by promoting sodium and water excretion. Furosemide is usually tried, although hydrochlorothiazide may be helpful in non-azotemic dogs. Question number 40. It is commonly used to treat frequent supraventricular or atrial premature beats and tachycardias. It is also used to slow AV conduction in atrial fibrillation. A. Angiotensin converting enzyme inhibitors, B. Beta blockers, C. Diuretics, D. Digoxin. The answer for question number 40 is letter D. Digoxin is commonly used to treat frequent supraventricular or atrial premature beats and tachycardias. It is also used to slow AV conduction and atrial fibrillation. Question number 41. It is a beta receptor agonist that has been used to treat symptomatic AV block and bradycardia refractory to atropine. A. Verapamil, B. Isoproterenol, C. Diltiazem, D. Amiodarone. The answer for question number 41 is letter B. Isoproterenol is a beta receptor agonist that has been used to treat symptomatic AV block and bradycardia refractory to atropine. Although artificial pacing is safer and more effective because of its affinity for beta-2 receptors, it can cause hypotension and it is not used for treating either heart failure or cardiac arrest. Question number 42. It has the most potent cardiac effects of the clinically used calcium entry blockers. A. Verapamil, B. Isoproterenol, C. Diltiazem, D. Amiodarone. For this question, the answer will be letter A. Verapamil HCl has the most potent cardiac effects of the clinically used calcium entry blockers. Verapamil's T1/2 in dogs is 2.5 hours. It is poorly absorbed and undergoes first-pass hepatic metabolism, resulting in low oral bioavailability. Moving forward, we have question number 43. It is indicated for supraventricular tachyarrhythmias. A. Verapamil, B. Isoproterenol, C. Diltiazem, D. Amiodarone. The answer for question number 43 is C. Diltiazem is indicated for supraventricular tachyarrhythmias. It is often combined with digoxin to further slow the ventricular response rate to atrial fibrillation in dogs. Diltiazem is the calcium channel blocker recommended in cats with HCM. For question number 44, it is indicated for refractory tachyarrhythmias of both atrial and ventricular origin. A. Verapamil, B. Isoproterenol, C. Diltiazem, D. Amiodarone. The answer for this question is letter D. Amiodarone's beta blocking effects occur soon after administration, but maximal class 3 effects are not achieved for weeks with long-term administration. Amiodarone is indicated for refractory tachyarrhythmias of both atrial and ventricular origin. For question number 45, it is a structural congener of enamrinone. A. Prazosin, B. Hydralazine, C. Milrinone, and D. Sildenafil. The answer for question number 45 is C. Milrinone. Milrinone is a structural congener of enamrinone, and the former is 20 to 30 times more potent than the latter. For question number 46, which of the following is an angiotensin converting enzyme inhibitor? A. Prazosin, B. Alacecapril, C. Milrinone, D. Sildenafil. The answer for that question is letter B. Recognition of the contribution of the renin-angiotensin-aldosterone system to the pathophysiology of congestive heart failure led to the development of the angiotensin-converting enzyme inhibitors, which includes the alacecapril and many more. For question number 47, it is an alpha-1 adrenergic selective blocking agent that can be an effective vasodilator through the adrenergic blocking properties on vascular smooth muscle. A. Prazosin, B. Alacecapril, C. Milrinone, and D. Sildenafil. The answer for question number 47 is A. Prazosin. It is an alpha-1 adrenergic selective blocking agent that can be an effective vasodilator through the adrenergic blocking properties on vascular smooth muscle, but it is little used in veterinary cardiology. Next, question number 48. It is an arteriolar dilator that has undergone limited study in dogs with volume overload heart failure and experimental heartworm disease with pulmonary hypertension. A. Prazosin, B. Hydralazine, C. Milrinone, and D. Sildenafil. The answer for question number 48 is B. Hydralazine. Hydralazine hydrochloride (USP) is an arteriolar dilator that has undergone Limited study in dogs with volume overload heart failure and experimental heartworm disease with pulmonary hypotension. Next question, we have question number 49. It is an orally active PDE-V inhibitor. A. Verapamil, B. Isoproterenol, C. Diltiazem, and D. Amiodarone. The answer for that question is letter D. Sildenafil is an orally active PDE5 inhibitor. Phosphodiesterase 5 is found in relatively high concentration in lung and pineal erectile tissue, and levels are elevated in humans with pulmonary hypertension. For our last question, question number 50, it is a non-selective beta blocker with class 3 effects at higher doses. A. Sotalol, B. Hydralazine, C. Carvedilol, and D. Metoprolol. The answer for that question is A. Sotalol. Sotalol is a non-selective beta blocker with class 3 effects at higher doses. D-sotalol alone prolongs repolarization but has no beta blocking effect. That would be all for our review questions for cardiovascular pharmacology.